So with this, I would like to invite our next speaker for the day, Dr. Ashoka Hadgali, from BMS College of Engineering. Dr. Ashoka?
Am I audible, madam?
Yes, sir. The
Yeah,
screen
yeah.
is visible.
Okay, yeah, it's fine. Thank you. Thank you for confirming. So this is Ashok from BMS College of Engineering, Bangalore. So I would like to share some of my research findings on the type 2 diabetes. So nowadays we find a lot of people suffering from type 2 diabetes. The reasons are plenty. Maybe the lifestyle, the genetics, or the various reasons we could list why people develop type 2 diabetes. And basically, when we say type 2 diabetes, the individuals will have the raised glucose level in their blood than the normal. And when we look at the components which are involved in the type 2 diabetes, so T2D, I call it as T2D from now on. So the reasons are these: pancreas, may not make enough insulin, because insulin is very important hormone in regulating the glucose level in the blood. That will facilitate the uptake of glucose into the cells. So if enough insulin is not there, then glucose will retain in the blood. That's one of the major reasons why people develop T2D. And also, over a period of time, the muscle cells, the tissues, they may develop resistance to this insulin. So even though if there is the insulin, since they have developed resistance, so again another reason why individuals will have glucose in their blood. And another interesting the fact is the individuals who are suffering from T2D, their absorption rate is very high, very faster, 50% faster than the normal individuals. So that's why their glucose level will go high. Again, endogenously, liver also puts a lot of glucose into the blood. So these are the four components majorly we list when we talk about the type 2 diabetes. And across the globe, people are thinking how we can correct this. So are there any measures to be taken? Because now, if the glucose level is not controlled, it leads to various complications. It may be nephropathy, or it may lead to the diabetic nephropathy, neuro or retinal, or it may lead to the cardiovascular or kidney disease. So how we diagnose this disease? So the one important test is the HbA1c test, so which will give us the average mean glucose level in the blood for a period of 3 months. Randomly also we can check, just because of some reasons, when a person faints, so because of some reasons, we can just check their blood, and sometimes we come to know that their glucose level is high, or their fasting level also may be high. We have the set of the standards. So when we say the individual is healthy, so their glucose level needs to be in a certain range. When we call them as pre-diabetic, so there are set of standards. We need to have the glucose level in that range. When we declare they are diabetic, their range is also known to us. So WHO says, or we have the International Diabetic Federation, we have IDF, we have American Diabetic Association, so various the organizations, they have given the set of the ranges for each the states, whether diabetic state or pre-diabetic state or healthy state. Another interesting test what people, researchers use to characterize the disease is OGTT, oral glucose tolerance test. It will tell us so how an individual processes the glucose when body takes in, right? So when we talk about normal, so the glucose curve looks like this for a period of 2.5 hours. When 75 grams of glucose is given on 8 hours of fasting, so their glucose curve pretty much looks like this. Means it will be well below the renal threshold level, which is 160 to 180 mg per dl. So all my units in this discussion will be in mg per dl, all my glucose levels. And when we say that, and it comes to their normal level, okay, fasting level. The fasting level is here. So after 2.5 hours, the glucose level will also come back to the same state. That's the normal individual, the glucose level. When we say that they are non-diabetic, when we call the individual is diabetic, Obviously, their fasting glucose will be high, so above the 125 mg per dl. And another interesting characteristics what we need to notice here is the peaking, right? So usually the peaking will be within 1 hour. So 1 hour in non-diabetic individuals. When we say that people is diabetic, it will be slightly towards the right after an hour. The peaking will be after 1.5 hours, delayed peaking, and it will not come back to its original level, right? It will be well above the renal threshold level. So we call them as diabetic, mildly diabetic, moderately, severely diabetic, based on the amount of glucose they have, right? So no diabetic, it's around 5.6 millimoles per liter. When we convert, it's 100 mg per dl. 100 to 125 is pre-diabetic, 125 and above, 120 from 126 onwards. So we call them as diabetic. Individual is diabetic. Fasting conditions. Postprandial, I mean after 2 hours of taking food. So it's up to 140 is non-diabetic, 140 to 200, 199 is pre-diabetic, and above 200 is diabetic after 2 hours. This range, right? So we just measure fasting at 1 hour, then at 2 hours postprandial. When we look into the literature, so a lot of people have put a lot of efforts to bring these people, the diabetic people, to the normal range. How we can bring them to the normal? Obviously, we have a lot of medicines available in the market which we can use, but nowadays we are looking into the sustainable, solutions so that we can reduce the side effects of using these English medicines. So people are looking into the natural ingredients. So how we can make use of natural ingredients to bring down their the elevated glucose level to the normal level, right? So sweet potato is being used to bring down their normal level. So what they do is they give systematically these natural ingredients. When I say natural ingredients, it could be, I mean, the aloe vera or sweet potato or saffron, or we have many. So I have as at least around 50 natural ingredients which are being used in the RCT studies, random controlled clinical trials on T2D individuals. Systematically they have studied, they have studied at least for a period of 3 months. So they have given the certain amount of these natural ingredients to the T2D individuals, and they have tested their glucose level. Okay, so this is for the people who have taken the sweet potato. And another study, I can see here they have given the fenugreek, and they have studied their glucose level. So after giving 3 months, every day they have given 5 grams of fenugreek. Then they have tested, their glucose level has come down. Then again they have tried with what you call the cinnamon and placebo and cinnamon. In any random clinical trials, we'll have a placebo and a intervention group. So the placebo and the intervention, you can see here, there's a good amount of the glucose has been reduced because of cinnamon intervention over a period of 3 months. And almond, very interestingly, so it has also shown very good reduction in the glucose level. So these are all, I mean, OGTT trials. So they have given before collecting the sample, they have fed with all these interventions, and the blood glucose level has been measured, and we have plotted before and after the interventions. So such the literature is available on the internet from the papers. So when we look at the mode of action of these ingredients, more or less they resemble our well-known the medicines. Most commonly prescribed, the first line medicine is the metformin, a biogunide medicine, which is given. More or less these ingredients are also acting in a similar way. They're also controlling, and when we look at their mode of action closely at the molecular level, so they are also trying to facilitate the uptake of glucose at the molecular level. People have also tried. They have tried on certain animal studies. They have shown that these natural ingredients like saffron have also ability to increase the uptake of glucose through several mechanisms, and they're able to sensitize the tissue to the insulin so that the glucose uptake is more, and so that the glucose level is reduced, and oxidative stress is also able to reduce. Inflammation is also, they're able to these interventions, they have multiple effects. Only thing is it's not, I mean, immediate like our regular medicines. So we need to take over a period of time, at least 3 months when we take. So we can definitely see these effects. So metformin, as I told, the similar effects. Then just since we had enough data, so I made use of this mathematical model, which is a very interesting mathematical model. It's a multi-component mental mathematical model developed by Dallam et al. In 2007. So these are the ordinary differential equations for each of the organs. So since the liver is very important in maintaining the glucose level in any individual, metformin also try to control the endogenous glucose production so that the glucose level is well within the range, right? So pancreas is another important organ. So secretion, insulin secretion is important. So keeping these in mind, so we have the ordinary differential equations and the respective parameters. Simple mass balance equations are written here, and I implemented these equations on the MATLAB and tried to simulate. So this is well matching with the metformin. I benchmarked the pharmacokinetics of metformin with my model and the experimental results. So our model is able to predict the pharmacokinetics of metformin. Then I have just studied the pharmacodynamics of certain ingredients. So here I've tested one of the, natural ingredient. It's your ginger, right? So we can see the first one. So here it is without any medicine, and this is with 0.2 gram of ginger, and this is just with metformin. And when we have given combination of metformin and ginger, so we can see the reduction of glucose. So the add-on therapy of ginger to the metformin has a potential to control the glucose here. And similarly, so can we reduce the dose of the metformin? So if you are, when we have given 300 mg of metformin, and when we have given 150 plus 1 gram of ginger, so we are able to get a good the match with the 300 mg of metformin. So the 50% of the metformin doses can be reduced because metformin has certain the side effects like stomach upset, many some certain effects are there, right? So yes, ginger, one example. And can we replace the metformin? We have went to the extent of just studying the replacement. Can we instead of having add-on therapy, can we have some certain blend which can replace the the usage of metformin, 300 mg of metformin? Yes. So this blend has given an equivalent reduction of glucose. For 300 mg of metformin. So we have found certain literatures also where they have tested and on humans, but not for this blend, but certain similar natural ingredients they have used to match the effect of metformin. But this blend needs to be confirmed. This is our simulation study. So what I'm saying is, yes, these natural ingredients, so they can be used as an add-on therapy to the metformin so that the doses can be reduced. So this will minimize the side effects of higher doses of metformin. So they may offer a balanced and patient-friendly treatment strategy for managing T2D, because T2D is nowadays it's becoming more common, especially in low-income countries. So it needs to be managed very well so that the mortality rate can be reduced, because every year the mortality rate is increased. With this, I would like to thank the organizer for giving me an opportunity to share my few thoughts. Thank you.
Thank you, Dr. Ashoka, for a very interesting talk. And it is really interesting to see in your results that ginger along with metformin is giving wonderful results, reducing the dosage of the metformin for managing type 2 diabetes in patients. And diabetes, as everybody is aware of, is a major health concern nowadays. About 40% of the population is suffering from diabetes, so this will be a very good option for the people who are suffering from the diabetes. Thank you so much. So kindly wait for the question answer session, which we will be taking at the end. Thank you so much.